Good morning.
Morning.
Morning, gentlemen. Thanks for having me back.
Yes, sir.
I wish I had a little bit better news as far as statistics. We continue to see a rise in cases in the county. This is a breakdown by age group, and what you can see is very few cases in seniors, which we are thrilled about, and certainly a reflection of the effort to prioritize seniors for vaccines up to this point. You can also see an increase in younger people. I do want to point out, because you see an increase in those who are under 15, we did take a look at children who have been back in school versus those who have been 100% virtual, and we found no difference in infection rates. And I want to make very clear that to this point we have not seen any transmission within the schools. Also want to point out that we are dealing with two new variants in the state and the region, the UK variant and the California variants. They're actually two viruses that are almost identical that were first identified in California and are now increasingly prevalent in Maryland. Those strains we know are more transmissible, and there's at least early evidence that they might actually cause more severe disease. As of yesterday, there were 10 people hospitalized at our local hospital with COVID, and there were more people hospitalized in their 30s than 70 and above. So this is something that we still, unfortunately, need to take seriously. The last fatality that we had in the county due to COVID was someone in their 40s. So everyone needs to continue to take precautions. When they have a chance to get vaccinated, extremely important, especially if they have any underlying health conditions, that they take that opportunity to get vaccinated. And it seems like we've been doing this forever. It's been a full year at this point since we had our first cluster of cases. So this is a graph looking at positivity rates going all the way back. Now, I will throw out there that up through May, there were very limited availability of test kits. So the only people who were getting tested in March, April, May of last year were people at very high risk, generally people who were hospitalized or people in nursing homes. So the positivity rates are artificially elevated because we were not testing people in the general public. So if you take a look from about June on, you can see that big peak that we had around the holidays and that upswing that we've had in the last few weeks, again, likely due to the variants circulating and potentially sort of relaxation in people's vigilance about the virus.
So Doc Polsky,
Yeah.
if somebody wants a test, what's the process?
So in the county, all of the primary care offices are providing testing, and all 3 urgent care locations are providing testing. So 7 days a week there are tests available. People just need to call, and they can go ahead and get tested. There's no limitations on the amount of tests available at the moment.
So the positivity rate is based on the number of people that test positive that get tested?
So positivity rate is the number of people who test positive divided by the total number of tests that are performed. So if you have 100 people get tested and 10 people test positive, the positivity rate would be 10%. And what we're seeing right now, our positivity rate is a little bit over 6%. So at this point, we're seeing, I think we can compare apples to apples, meaning that the availability of testing has been consistent over the past several months, whereas we can't compare what we're seeing now to back about a year ago where testing was very, very restricted.
So I know of someone that called their private provider because they had some symptoms. They thought they wanted to get a test, and that private provider asked a few questions and said, no, you don't need a test. Doesn't that skew the test results if a private provider is sort of going through a checklist? So that means people that would have just walked in and got a test would have tested negative and would be better representative of the population than a screening process, and you're only testing those people that you think are going to be positive?
Right. So there's no system that's going to be perfect. And I don't know if that's a one-off or how often that happens in general, because we are seeing thousands of tests being done every week. So I can say that the vast majority of people who are calling and wish to be screened are getting screened. And on the flip side, there are people who are going in for things that they would not necessarily have called to get a COVID test, but when they complain that maybe their allergies are worse or their asthma is acting up a little bit more, their family doctor is saying, we really need to screen you for COVID. So things work both ways with that. And I've mentioned before, but I will take the opportunity that involving primary care providers, I think, has been a tremendous boon to the people of this county. If we take a look at fatalities, if we were proportional to the number of deaths statewide, we would have had 57 more deaths in this county than we have right now. And if we take a look at hospitalizations, 270 more people would have ended up hospitalized if we were just at the state average. So the idea of having family doctors involved in decision-making, I think, is keeping people healthier overall. So I'm going to transition to vaccinations. As most people know, the majority of vaccines have been shifted over to the mass vac site, so this just gives you some numbers of what's happened very recently. On the right side of the screen, you see what we're getting locally. Our health department has been nudged up from 500 doses a week a couple weeks ago to 700 doses this week. The hospital received 200 doses. And then the pharmacies have a question mark because we know which pharmacies are getting doses, but the state doesn't make it clear how many those pharmacies are getting. So that 500 to 800, it's somewhere within that range. And then the whole bunch of initials down below. So Calvert Internal Medicine Group, for the first time, received 100 doses this week, which they very quickly were able to administer to their thousands and thousands of patients. And then the Calvert Health Medical Group, so the primary care people affiliated or under the hospital umbrella, received 200 doses. That's part of a new program, which I think should have been started a while back, but at least they finally got it off the ground, where they're now piloting giving vaccines directly to primary care providers. And I think this will also increase the number of people who are getting vaccinated. Not everyone's going to go to a website, and I can say that when I was in practice, if I told one of my patients I think this is really important for her, it was, I think, much more impactful than just seeing a public service message. Our hope is that over the next few weeks, the number of practices who are allocated vaccines and the number of doses they're each getting will continue to go up. And then you can see on the left side of the screen, just the vastly different, the scale of the doses is just dramatically different. So the Regency Stadium in Charles County just opened up about 2.5 weeks ago. They've already received 62,000 doses of vaccine, and you can see the number for Six Flags in Prince George's.
Dr. Polsky, on that note, sir,
Yes.
is the federal government in control of Regency Stadium? Is that?
No.
That is a state?
It is a state.
Okay.
To the best of my understanding, the governor tasked the National Guard with running that site.
Okay.
And then so this breaks down a little bit for what's happening locally. The number of Calvert residents who've been vaccinated at any mass vaccination site, and this goes back to when the first sites, about a month and a half, 2 months ago. So in total, about 1,300 residents have been vaccinated, 438 at the mass vac site in Charles County, and about 800 at Six Flags. The total number of Calvert residents who have been vaccinated at any site per the state's latest data is about 22,500. And actually, since I made up this slide a little bit ago, we're up to 12,700 vaccinated through the health department, about 2,900 through the hospital, and then approximately 5,000 through the pharmacies. And then, as I put on the slide, that includes the early efforts with some of the nursing home vaccinations that were done by CVS and Walgreens. There are some doses missing, and that's primarily for people who work out. They live in Calvert, but they work outside of the county. They may work at Anne Arundel Medical Center or the hospital in St. Mary's, or they may be law enforcement in another county. So some people have gotten vaccinated through that means. And that's a whole lot of numbers. I think the take home from this is that about 24% of Calvert residents have at least received a first dose, which is a little bit above what the state average is, which is about 23%. And about half the number who have received a first dose have already received their second dose. The percentage of people coming back for second dose is actually very high, over 95%, which we're very happy to see. And of course, those getting Johnson & Johnson, it's a one and done. And then did want to close with just the horrible chart. It's taking a look at new cases per 100,000 in the past 7 days. And you can see that because our numbers have consistently climbed over the last month, that we are over that 164 per 100,000. And the positivity rate, I'm sorry, I think I said 6 point some percent, but it's 7% for the last week. And that's it for the slides.
So Doc, question. So the CDC has gone from 6 feet to 3 feet. What's the basis of that?
So what you're talking about is in reference to the schools, not just in general.
Well,
So-
I mean, I would
so
think
see-
it would apply, if it applies to school, should apply in every, I mean, there should be no difference of being in a school or being in a building or,
Well, so the CDC's recommendations only apply to children in schools. They do not apply to adults in schools. So this recommendation is separation of children to teachers or other adults, or adults to adults in schools is still 6 feet.
is
Evidence,
there a logic to that?
yeah, there is.
Okay.
So the evidence, I will say, is still accumulating, and this is not what I would consider in any way, shape, or form hard science at this point, but there's gradually increasing evidence that children are less transmissible to other children. That there's a lot of vague data when it comes to middle school and high school level, but the CDC came out with their explanation. They did not come out with an accompanying 20-page treatise on how they arrived at these conclusions.
So on paper, I guess you would, I don't want to put words in anybody's mouth, but the belief would be 2 12-year-olds are not as dangerous as 2 30-year-olds
Well, when you say
to
dangerous,
each other, to transmitting to each other.
so most of the evidence shows that 2 12-year-olds are less likely to transmit to each other than 2 30-year-olds, yes.
So a flu virus knows the age of the person, I guess, is what the, I mean,
So, and I know you're
you know
being
where I'm
somewhat
going with
facetious,
this.
but so-
I
so
can't make sense of it.
Viruses are indifferent to any of our actions. They just,
So they're
do
saying
what
it's
viruses
action-driven,
do.
not age-driven.
we are still, to give you the deep, like, why does it transmit less readily between, and 12-year-olds, again, it starts to get vague as you hit around adolescence. So let's just back it up to, say, 2 7-year-olds. Why 2 7-year-olds are less likely to transmit to each other? And that does not mean, because I've heard people confused that they can't transmit. They can. And we've seen that many occasions where one sibling picks up the virus, and it's oftentimes been through travel sports, but it's been other places as well, and then they bring it into the home, and then the siblings all end up catching COVID. So I want to make it clear that children can transmit to other children.
Because what's crazy is typically children interact much more physically and closely, especially in a school setting, than adults would. You don't see 2 teachers high-fiving each other on the playground. Not typically. But, kids, high-fiving, interact as kids do, So that's what is hard for me to understand is all that interaction doesn't seem to bother the CDC as much as people staying away from each other. I mean, it just seems like it would be the opposite. Right?
Well, I'm not in discussions with the CDC, so I'm not sure how to kind of follow with your.
Well, it just
But,
seems from the outside looking in that they're saying, okay, well, 3 feet is okay inside of a school. And I think, and I ain't putting words in anybody's mouth, just my own personal, not Calvert County, is they figured out that, hey, 6 feet, I can't get them in school. So I'm going to say 3 feet, because classrooms are already 25 kids a class. So if it's safe to be 3 feet in that setting, then it's safe to be 3 feet anywhere.
But
So
the CDC, what didn't get publicized, Mike, is they still have the other requirements in place. If you're in a high-risk category, you can't do 3 feet.
Right.
There's other components, so they didn't just say, okay, go to 3 feet in elementary school and middle schools. There are still these other conditions. Just like the governor announced a week or so ago, restaurants can go to 100%.
But he
But
hasn't
that's all he
relaxed to
said.
6 feet, right?
But he didn't relax to 6 feet. So the news, picks up bits and pieces that get you to watch. and don't give you all the detail. So, the people that are screaming for get the schools back full again, the 6-foot requirement is still there.
Right,
And
that hasn't been lifted, right?
that has not been changed.
And that's what I'm trying
Yeah.
to make sense of here is, the CDC kind of writes the script for the rest of the country, right? I mean,
Right.
that's where everybody goes to when something hits.
Right.
First thing you see is CDC, and to make a statement like that, to say, well, 3 feet in there, but not 3 feet, say in
High schools.
or yeah,
You
yeah.
can't have 3 feet in high school.
or say a Walmart or whatever. You know what I'm saying? I mean, it just seemed. I remember a time, when AIDS came out, and there was all these people, all these authorities saying, well, you don't get it this way, and they just really didn't know. And I think the better statement would be, we just don't know. I mean, would be the honest statement, because it's just hard for somebody like me to understand that a kid is safe in 6th grade, but he's not safe in 12th grade. I mean, and then especially if they're saying, well, it's behavior driven, it's definitely not biology driven. I can't imagine the disease is
Oh,
doing
well,
a question.
no, it absolutely is biology driven.
So you think there's a difference between a 12-year-old and a 15-year-old?
Oh, yeah.
When it comes to catching the
There's
flu?
well, there's clearly differences between 12-year-olds and 15-year-olds, and there's clearly differences between 7-year-olds and 12-year-olds.
But the 12-year-old's less vulnerable than the 15-year-old.
So again, I can give a potential, but I cannot say why. So we know that all viruses need to bind onto our cells to be able to infect. We know that this particular virus binds onto the ACE2 receptors. It is quite plausible that the ACE2 receptors go through some kind of maturation process that in children does not allow the virus to bind on as strongly as it does as we mature. Now, we don't know that, so I don't want anyone to leave this discussion thinking that's why, but that is a very plausible explanation.
It's very
Mr. President?
confusing.
I guess we'll have to see. I guess history will.
And everyone's trying to balance the best they can. I think in a very crude way, we set speed limits out there. Do we think that no one's going to die in a car crash because they're going 40 or 55 miles an hour? It will happen, but you're less likely to die in a car crash going 40 miles an hour than going 80 miles an hour. So what everyone's trying to do is balance. They realize that it's important for kids, for socialization, for emotional, and for academic, for them to be in school. On the other hand, there is a real cost because, as I mentioned, we are seeing younger people getting sicker at this point, and we still have kids who live with their grandparents. And what everyone's trying to do is balance the best they can. There's no perfect solution at this point.
Doc,
Commissioner Hutchins, were you trying to get in?
Yes, Mr. President, Doctor, just a couple questions. At what age range are we working on now and generally as far as administration of the vaccine?
So we are starting to lower down to 60 and above. We know that we've vaccinated the vast majority of 65 and over, but we know there's some people who still have not been able to get vaccinated, so we will continue to prioritize. So as we see more 65 and over register, we will move them to the front of the line. But at this point, if we restrict it to 65 and over, we may end up with unfilled slots, and we certainly don't want vaccines sitting in refrigerators.
Sure. With regards to the underserved, how are we assessing that situation? They may not have a physician to go to.
Right. So I think we're doing a very good job in the county. We're certainly working with social service. We're working with Department of Office of Aging to make sure that we are getting the word out. We're doing outreach in minority communities. And when we take a look at distribution among those demographics, then again, we're certainly doing better than the state as a whole. One of the advantages to having vaccine in physician offices, and I realize it's not going to get to people who don't have a primary care, but 96% of people in this county have health insurance and they have access to physicians and nurse practitioners. One of the advantages of having vaccine in doctor's offices is that they can take a look to see who is Medicaid eligible. I think one of the forgotten groups are low-income people. And as a health department, we have no way of assessing income stratification, but at least doctor's offices based on insurance can identify people who are lower income and can do outreach to them and try to get those people better vaccinated.
Well, I understand that the capabilities of the health department, but working in conjunction with our community services, to do the best we possibly can to identify anyone in the underserved and collective work with the physicians. But, while 96% of us might have health care, there's still 4% out there that we just can't let fall through the cracks. So we've got to keep focus on that.
Absolutely.
Lastly, is just the overview of the picture. It hadn't changed. The situation is that COVID remains a threat, its variant remains a threat, and our mission is to be able to defeat that in order to get our kids back to school on a full-time basis, in order to get our economy back running, and consequently, at some lag time beyond that, 6 months, 8 months, be able to reach an employment figure that was somewhat near pre-COVID levels, perhaps. So I think for the general public, that's a simple way of looking at what we're faced with and we're continue to be faced with, and we all just need to keep doing our part. Thank you, Doctor.
Absolutely, Commissioner. Regardless of what people think their personal risk is, everyone who's vaccinated means it's less likely as time goes on that the virus will continue to transmit, and we, as you said, we can move back toward that normalcy that we would all very much like to see.
Thank you.
Commissioner Weems?
Yes, sir, Mr. President. You touched on where we are. I mean, the governor's orders, I have deemed it the apex executive order, which everything flows below. Last week, I believe we were supposed to go into phase 2.
Actually today.
Today.
Right.
Okay, and that's still a go, correct?
Correct.
Okay.
And so now they've broken phase 2 into 3 subgroups. So 2A starts today. That's people who are 60 and over, as opposed to 65 and over, are now eligible. And then the following week, it opens up to any adult with chronic underlying health conditions, and there's a laundry list through the CDC for people to qualify. And then 2 weeks after that, it drops down to age 55 and over, and then the last week in April, it's all comers.
Okay.
Again, the hope and expectation at this point is that the supply of vaccine through the federal government, through the national supply, will increase significantly starting next week.
Thank you. Thank you.
All right.
All right.
Thank you, sir.
Thank you,
Thank
gentlemen.
you.
Have a good day.
Thanks, you too.